Name is Senjalia Hitenshu and my today's topic is HUMERUS. Let me see the introduction of HUMERUS. The HUMERUS is the long bone in the upper arm extending from the shoulder to the elbow. It connects the scapula and the radius and the ulna from the lower arm. Here you can see the red color mark board is the HUMERUS, which is
Okay.
here you can see in red color this bone is the HUMERUS, which connect the scapula and the radius and ulna bone. This is the radius and ulna bone, and this is the shoulder joint and scapula. So now we can see the origin and insertion of HUMERUS. Many muscles originate and insert on the HUMERUS, including the deltoid, pectoralis major, bicep brachii, tricep brachii, brachialis. Here you can see in the picture there are so many muscles which is originate and insert in the bone. Also, I have the model of the HUMERUS. Here you can see this is the bone of HUMERUS, which is this is the left one, left side of the HUMERUS. So in the surrounding of this bone, the many muscles which can be originate or insert. Now we can see the blood supply. The blood supply to the HUMERUS primarily comes from the brachial artery, which is the continuation of the axillary artery. Branches of the brachial artery, such as the profunda brachii artery, provided blood to the bone and surrounding tissue. Here you can see in the picture there are the blood supplies of the proximal HUMERUS. Many arteries can be goes and it will supplies the blood to the HUMERUS bone and etc. Now we can see now we can see the nerve supplies of the HUMERUS bone. The primary nerve supplies or the HUMERUS are branches of the brachial plexus, including the musculocutaneous nerve, radial nerve, medial nerve, and ulnar nerve. These nerves innervate the muscles around the HUMERUS and provide sensory insertion to the skin of the arm. Here you can see the many nerves also get inserted in the HUMERUS bone. So these are the many fractures are there. From there the nerves can be come out or goes inside. Now we can see the articulation of the HUMERUS bone. Proximally the HUMERUS articulate with the scapula and the glenohumeral joint, forming the shoulder joint. Distally it articulate with the radius and ulna at the elbow joint. Now here you can see in the picture that so many fossas and older cavities and fossas are there in the HUMERUS bone. So now we can see the anatomical landmarks of HUMERUS bone. Anatomical landmarks is very important to understand. So let me start. Key anatomical landmark of the HUMERUS include the head, greater and lesser tubercles, anatomical neck, surgical neck, deltoid tuberosity, and medial and lateral apricot neck. So here you can see in the picture there are this one is the anterior view of the HUMERUS bone. This one is the posterior view of the HUMERUS bone. And at there you can see at the upper side the greater tubercle is there, lesser tubercle is there, intertubercle groove is there. So this is the whole landmarks, anatomical landmarks of the HUMERUS bone are present. So now we can see the functions of the HUMERUS bone. So how the HUMERUS will function, what type of activity, what type of movement should be helped by done by the HUMERUS. So the HUMERUS plays a crucial role in arm movement, including flexion, extension, abduction, adduction, and rotation movement. So all the movement which is done by the shoulder joint is will also play done by the HUMERUS joint. So it provides attachment points for various muscles involved in shoulder and arm movement. So here you can see in picture a lady and a male will do the flexion of the elbow joint. So now we can see the ligaments around the HUMERUS joint. First is glenohumeral ligament, coracohumeral ligament, transverse humeral ligament, medial, which is also known as ulnar collateral ligament, lateral, which is also known as radial collateral ligament. So these are some ligaments which is attached by the HUMERUS joint. So this is from my thank you for watching. I am Hitenshu Senjalia in first year BPT in Marwadi University. Thanks a lot.